The views and opinions expressed on this program do not necessarily reflect or represent the views and opinions of 580 WCHS or West Virginia Radio Corporation.
And a very pleasant good morning to you. You're listening to Ask the Expert, WCHS, the voice of Charleston. I'm Dale Cooper. Thank you so much for tuning in on this kind of chilly Wednesday morning. It's supposed to warm up a little bit later on today, but if you're heading into work this morning, you're listening before you get into your car, you might need to start your car or go out there and plan on having time to scrape your windshields off this morning. I know I had to do that before coming in this morning, so just a little tip for you before you come in to work this morning. But thanks for listening to Ask the Expert. I'm Dale Cooper on 580 WCHS. We are the voice of Charleston. Very pleased to have a guest in studio today from WVU Physicians of Charleston. We're going to be talking about something called the COATS program this morning, Comprehensive Opioid Addiction Treatment Program. But let me go ahead and introduce our guest. We have Dr. Hani Nahza in here. And good morning, Dr. Nahza. How are you doing this morning?
Good morning, Dale. Thank you very much. Thank you for having me. And good morning, Charleston.
Thanks for coming in. And I appreciate you taking time out and talking about this really important issue because opioid addiction in West Virginia is really something that has been, I mean, it's a financial strain on the state. It's a social strain on the state. It's anything that you could imagine that ties into the state's well-being. The opioid crisis, whether it affects you immediately or not, is something that does affect you because of exactly what it's going on in the state. Exactly. Tell me a little bit about the background as far as the opioid addiction goes and what we've seen over the last, however long it's been, 10, 15 years, as far as this spike has been, and the reason that WVU Physicians of Charleston has gone to this COATS program.
So actually, opioid addiction is nothing new. It's been going on for years and years. Now, we've seen a spike in the past, I would say, 6-7 years. So pretty much, we can start actually in 2013. There's a very interesting statistics that in West Virginia or West Virginia providers, they wrote 110 opioid prescription per 100 person.
Wow!
So pretty much we had like 2.08 million prescription in that year. So pretty much the average was almost 1 and something prescription per person. So later on, 2013 or 2014, the CDC started like reshaping the opioid prescription or how to prescribe opioid to patients with chronic pain. And in 2016, they came up with new guidelines how to prescribe pain medications to patients with various kind of pain. And this is when lots of providers in the valley, they actually cut their patient off. Some of them were cut off like cold turkey. And this is when they turn to the street and they start abusing drugs from the street. So I would say probably we're talking about somewhere between 2014, 2015, where the epidemic became became unmanageable somehow. The problem has been going on for years, of course. Now this is portion of the problem. The other portion is people who started doing opioid as for recreational purposes, right. And that's been going on for years. Hasn't actually changed, but after we had like more patients asking for drugs, the peak went up in the past, I would say, 5 years, actually.
Wow. And in this area, of course, it's kind of like ground zero for this problem nationwide. West Virginia, unfortunately, leads in a lot of the statistics as far as deaths per capita and hospitalization per capita. I mean, it's a very dangerous thing, and there's many different avenues where this is being approached on a federal and on a state level. You talked a little bit about how the CDC went in and made some changes in 2014. There's been some other massaging of the way that the guidelines are put together before the medicines are prescribed. And we're trying to be more socially aware of these things. But the bottom line is, whatever happened to get you addicted to opioids, or your loved one, your family member, your neighbor, whoever it might be, we have to find treatment. Hopefully it's not your job, unfortunately, because you'd probably do a better job, but it's not your job to address what happens before, other than making sure that as far as you can go as far as prescribing medicines or anything. But there's not a whole lot that you can do on that. We need to focus on recovery from it. And recovery is an important thing, because I think that we found, if I understand some of the data right, that if you get through a program and you do get into recovery, that the possibility of reintegrating yourself into society and being productive once again, and maybe if you're somebody who had a job and life ahead of them before and had fallen on hard times, you can recover a lot, if not all of that, but you have to get through some sort of program that's going to help.
Exactly. And before I start talking about the programs, just want to mention a couple things here.
Sure.
The first one is, of course, 2016, West Virginia had the highest rate of opioid-related overdose per capita. So we had like 43.4 deaths per 100,000. Wow. That's too much. Now, the other problem that I want to talk about is we always talk about opioid epidemic, but we don't mention much the methamphetamine epidemic. And this is actually, it goes hands in hands. That's the problem. So treatment of opioid is there. I have lots of medication that can actually help. The problem is I don't have much help if I'm talking about methamphetamine. So getting medication for opioid is easy. Lots of physicians are certified. Just, 8-hour certification, you can prescribe medication to treat opioid withdrawal or opioid addiction. The problem is the treatment of addiction. So it is not only the substance that make people go back and do it or make people addict. It's actually the whole situation. So rehabilitation means more than just taking a pill or taking a strip or taking a shot. It's more than that. It's actually how we reshape our lives to be members of the society again. And some people have been doing drugs for 20 years, 25 years. Some of them, they normalize drug use, and they don't feel this is different.
Right.
So they have to reshape everything in their lives to be part of the society again. And that's why we need to incorporate lots of behavioral mechanics in the treatment of drug abuse. And this is when actually the what we call the code module was created actually a long time ago, and that was created in WVU Morgantown. And I would name probably Dr. Sullivan, who was the one who created that back in the days. And now Dr. Jim Barry up in Morgantown is running the program, and he's doing a fantastic job in that regard. And actually, about a year and a half ago, we had a meeting up in Morgantown, and we say that we need to spread this module all over West Virginia. We need to have patients well taken care of. That's exactly the word we use, well taken care of. Because it's not only you come, you take the strip, you go home, see you next week. No. So we incorporated a very strict system in the treatment of opioid and other drugs. So not only someone who says, my substance of choice is only opioid. If the substance of choice is opioid plus there's lots of other substances on board, we can actually take him to the program, help him with the opioid with medication assisted. Could be buprenorphine, which is generic for Suboxone or Subutex or Sublocade, lots of formulation for that. Or we can do naltrexone injectables. That's generic for Vivitrol injection. So we can do that, plus the behavioral module. So the behavioral module that we use, patients come to our office once a week in the first 90 days of recovery. And this once a week, they come for at least 2 hours.
Okay.
The 2 hours will be 1 hour with me, 1 hour with a counselor. So the hour with me, we talk about substance use in general. We do some psychoeducation about sobriety, how the brain recovers. We talk about relapses because we know this is a chronic problem, so relapses may happen in the first couple months of treatment, and we actually try to have a plan. So if someone come to me and say, well, doc, I relapse, I had like bad time, this is what happened. So we talk about ways to stay away from drugs, how to change their environment, all the relapse triggers, all that. And also we talk about medications, how medication has been helping. We talk about going to meetings, actually, and that's the other part that we'll talk about after we talk about what we do inside the department. Mm-hmm. So after I'm done, and that's almost between 45 minutes to an hour, and of course we do urine drug screens. And I tell my patient. It's not because I don't trust you, but I don't trust drug abuse.
Right.
And that's why we need to do supervised urine drug screen. And that's what I tell everybody. A valid urine drug screen is a supervised urine drug screen, because this is when I have better idea about what's going on, so I can fix it. The other hour will be actually counseling. So we provide counseling once a week plus the government required once a month. So it's not only you come to me for counseling only once a month. No, it is going to be once a week. And we do these two treatment, the 1 hour medication assisted and the 1 hour counseling, in a group setting. So I have patients who sit in the same room. It's like a support group, but inside medication-assisted treatment. Then also we require our patients to go to 4 meetings every week. Okay. It's either AA, Alcoholic Anonymous, or Narcotic Anonymous. Actually, we have a list of meetings that we believe they are a good meeting, and we ask our patients to go for them. And of course, we try to do that, and I tell my patients, you've been looking for dope for years, and now I want you to look for sobriety.
Right.
So you've been leaving your house looking for your fix for years. Now I want you to leave your house to look for your sobriety. That's actually the whole
sobriety has to be an active pursuit and not a passive pursuit.
Exactly.
You have
to
with the same passion.
Exactly, 100%. So they need to feel, they need to identify themselves as persons in the society, trying to make a difference and trying to go back to the society. And of course, we actually try to talk about 12 steps modules, and which is a very important part of the AA or NA ideology. And we encounter lots of relapses, and this is when we actually deal with it. So if we have chronic relapsers, we do something called IOP, which is intensive outpatient programs.
Okay.
So intensive outpatient programs, it's not you come 3 times a week, get your prescriptions. No, it's you come 3 times a week for classes, plus the 4 meetings you are required to. So and this is not a punishment. This is actually more work to get sober.
Right.
And of course, we try to get them a sponsor, someone who they can talk to. And I always tell them, we are very accessible as a program. You can call at any time. If it's during working hours, we can always talk about things. If you feel like relapsing, you're under stress, lots of people calling you to offer drugs. Just call us. And another option, we have our inpatient unit at General Hospital. Sometimes patients will voluntarily admit themselves for a couple of days just to stay away from their environment. Now, the third tier, which is pretty much if someone fails all that, we work with them to find them inpatient rehabilitation. Now, the challenging part in inpatient rehabilitation, most of them here in the area are sobriety-based, so they actually don't accept patient on Suboxone.
I see.
So we have to wean them off first, and we do that actually in our inpatient unit before we send them to long-term rehab. I'm talking about 28 days or more rehabilitation. So that is another option we do actually. So I am a big believer of personalized medicine. So if we are 2 patients, doesn't mean we'll get the same treatment. One of us may get Suboxone, and the other person may get Vivitrol, depends on the challenges the patients are having. And also, I just want to mention to our audience here that buprenorphine is an opioid partial agonist, so that's still somewhat an opioid. And lots of people may say, yeah, it's a street drugs, and people still abuse it. And I totally agree with that. And that's why we need to have a very strict environment to use it. And it's not for everybody, by the way. Some patients come to me and say, well, that's what we do. We love it. And I'll be like, probably that's not the best option for you, though.
Yeah, right.
Yeah.
So much that you talked about there that we need to unpack. We'll circle back to some of these things that I want to talk about just for a minute, but I want to make sure our listeners know out there that our guest this morning from WVU Physicians of Charleston is Dr. Hani Nahza. We're talking about the COATS program, which is the Comprehensive Opioid Addiction Treatment Program, located at 3200 McCorkle Avenue Southeast. That's in Charleston. The phone number is 304-388-1000. 304-388-1000 is the number you can call to follow up information about the COATS program if you have any after the program today. If you want to give us a call, you're welcome to do that. Our number is 345-5858, 304-345-5858. Maybe you'd like to share the story of a loved one, or if you have a question about someone who's in your life that you're aware of, and how to approach someone who's suffering from addiction, this might be a good opportunity to at least make a phone call and get the process started. 304-345-5858. You're welcome to use an alias as well when you go in the air if you don't want to use your real name. We understand when that happens. Dr. Nahza, there is so much great information that you just talked about. A couple things I wanted to kind of start at the beginning, I guess. You did mention that sometimes people will feel challenged by their environment. And one of the things that I understand in some of the reading that I've done is the socioeconomic circumstances. Again, we talk about West Virginia as a state in general, usually on the lower end of those things when it comes to prosperity and happiness indexes, things along those lines. That all ties back into, that's really baseline, ties back into the way of life that a lot of people who are addicted to opioids, that's the way that they live. It's the way that they were brought up. I mean, unfortunately, sometimes you not only can you be overprescribed and get addicted that way, but you can come up in an area, in a family, that's just the way of life. Yeah,
I understand. And that's why we try to actually accommodate lots of family members in the same program.
Wonderful.
And what I've noticed is, of course, I don't like them to be in the same group. So they, if someone has something to say, they feel free to say it. Of course, family treatment is very important. And if the mother is addicted, the daughter is addicted, and the granddaughter is addicted, they all need to be treated because pretty much this is big temptation. So and depends on the tier of sobriety they are in. So if they are in the first tier and they have lots of challenges, seeing another person using in front of them, it's a big problem.
Sure.
They will go into the autopilot mode and they will just do it. And that's why the family treatment is very important. So I love to accommodate actually families. And the other thing I want to talk about here is what I call integrated care. It's not only the psychiatric care, it's also the medical care. What I really want to stress here that lots of our patients with substance abuse problem, they have lots of medical problems, infectious disease problems, or other problems like high blood pressure, diabetes, lots of things from the unhealthy lifestyle. And also, as someone who was trained in internal medicine and in psychiatry at the same time, I love to do integrated care and give them medical treatment and psychiatric treatment, because I understand the resources to their medical treatments are also lacking. And I would love also to provide them medical care and psychiatric care. And we do that certainly in our WVU code program. So actually, going back to your point, Dale, family treatment is very important. Also, friends treatment, that's another thing. Because lots of patients with substance abuse problem are estranged from their families, and they live in their friendly society, which can be very dangerous. So pretty much if they don't make a change, it's not going to work out. So sometimes, the patient comes to me and say, well, my girlfriend or my wife is addicted. I'll be like, how about you see if she can come here, be a patient in a different group or the same group, depends on the agreement. And we'll try to provide substance abuse treatment for both of you. That's actually good to help your daughter, for example, or your son. That is the way I think it should be done.
This is just scratching the surface, and what I'm trying to do is just reveal the complexity that's behind treating someone who is overcome with the disease of addiction, because your job in helping these folks go through with the addiction program and in Coates, it's not purely medical, it's not purely psychological, it's not purely any of these one areas of medicine that you have to know how to do. You have to be able to evaluate this exact thing that you just talked about, the environment that they're in, and then try to give them escape avenues from that environment. You bring in the family to help get them off addiction as well. If you can't do that, then that person needs an escape route. They need to be able to get out of that circumstance in some way, because it would be be virtually impossible to completely recover if you're still living in the circumstance that got you addicted to begin with.
Yeah.
And that's a monumental task for you and the folks at the COATS program to take on, but it is something that you find success with. And I think that it's very important that folks understand out there, if you have a loved one, if you yourself is in a dire need, you know a neighbor that has that problem, it may seem like that it's just an impossible task because of their circumstances, where they are, who their family is, who their friends are, how they were brought up. But there is an opportunity. There is possibly a chance, and that's what we're talking a little bit about this morning with Dr. Hani Nahza. He's a medical doctor with the COATS program with WVU Physicians, once again located at 3200 McCorkle Avenue Southeast, and the phone number is 304-388-1000, 304-388-1000. Online, you can find more information at WVUPC.org. That's WVUPC.org. What we're going to go ahead and do now, we're going to take our one break. We'll get that out of the way when we come back. Still so much we're going to talk about. I want to ask Dr. Nahza to give us a little bit of advice when approaching loved ones, family members, neighbors, whoever it might be, and maybe trying to help them get enrolled into a program like COATS, overcoming some of the objections that you might run into. That's what we're going to talk about next. Plus your phone calls if you want to weigh in on the conversation. 304-345-5858, 345-5858. I'm Dale Cooper. You're listening to Ask the Expert. This is WCHS, and we are the voice of Charleston.
This is the Savage Nation.
Michael Savage here to tell you that big changes are coming next year. I'm launching a new podcast on the Westwood One Podcast Network. This will be an entirely new listening experience where I will be unleashed, unvarnished, fresh content each day starting January 7th.
So you want to catch the Savage podcast, do you? Go to iTunes on Apple or go to michaelsavage.com or wherever you get your podcasts now.
From the Westwood One Podcast Network.
Why Charleston? Because it's my Charleston, and here's your chance to tell us who makes a difference in your community. An individual you feel has gone above and beyond to enhance the quality of our community, and we'll make sure they get the recognition they deserve. Every month, we'll recognize a new champion of Charleston on air and through social media venues. Fill out the form at WCHSnetwork.com/champs and submit a short story telling us why and who you want to nominate. The champion of Charleston from West Virginia Radio Corporation and the voice of Charleston, 580 WCHS.
Good morning. No accidents to report, but we have the usual traffic congestion heading into Charleston eastbound on I-64. There's a closure for later this morning in Putnam County. Route 35 northbound and the Route 35 southbound flyover bridge off the Crooked Creek exit that merges traffic onto I-64 eastbound will be closed today for deck repairs from 10 a.m. to 4 p.m. The alternate route is West Virginia Route 34. Traffic brought to you by City National Bank, where you can purchase or refinance your home with a no down payment mortgage. City National Bank, equal housing lender. This is Jeannie Kay on the voice of Charleston, 580 WCHS.
You're listening to Ask the Expert, WCHS, the voice of Charleston. I'm Dale Cooper. Thank you so much for tuning in on this somewhat chilly beginning of your Wednesday morning. It is going to warm up a little bit later on today, but just be aware as you're coming into work this morning, there could be some ice on your windshields and things along those lines. This is 580 WCHS, the voice of Charleston. I'm Dale Cooper. Our guest this morning from WVU Physicians of Charleston is Dr. Hani Nahza. He's a medical doctor with the COATS program. COATS is Comprehensive Opioid Addiction Treatment Program. It is a program that we're talking about this morning that is really a fantastic, as is revealing on the radio this morning. If you haven't heard of the program, it's a fantastic program to help folks who are addicted to opioids. And Dr. Nahza is really sharing a lot of his information and approach to treatment this morning. And I think that it's very important. The contact information, once again, WVU Physicians of Charleston, the COATS program, 3200 McCorkle Avenue in Charleston. The phone number is 304-388-1000, 304-388-1000. And the web address is WVUPC.org, WVUPC.org. So, Dr. Nahza, one thing that I wanted to ask you about, in West Virginia, there is very little degrees of separation between somebody who is sober and has no addiction problems at all to knowing someone who does suffer. I mean, if it's not somebody that you know immediately, then somebody who you're very close to knows somebody who's suffering. I mean, there's just not much separation that's involved with that. So if you needed to approach a loved one, a friend of a friend, even, it's like, hey, you need to talk to your mother, you need to talk to your sister or whoever it might be, What are some ways that you can approach that as far as being positive into what the future may hold for them? How would you get someone who maybe has been reluctant to get into a program or been obstinately reluctant to get into a program? How do you break down those barriers?
Yeah. So first of all, most patients with drug addiction problem, they know they have a problem. But at some point, they switch to, I'm not doing the drugs to get high anymore. I'm doing the drugs because I don't want to be sick.
Mm-hmm.
And this is actually a golden place where we can actually work with them to help them out. Of course, even the previous period is also, they can get some help, but most of them actually will not volunteer for any help at that point. So if you see a beloved one that is struggling with addiction, having a serious conversation in a non-judgmental way, this is extremely important. If I judge you as a person, there's no way I can help you. So I need to go and tell my son, for example, that I understand what he's going through, and I understand this is not easy. And I heard about some programs where he can voluntarily sign himself in either outpatient or inpatient treatment and get better. So they actually need to start from life is good. Life is not all bad. We have good things in life, we have bad things. So how about we concentrate on the good things now? How about we try to get better so we can actually look for a brighter future? Another thing they can use actually is to use something they love. And that's actually my approach. And I tell my patients, whether you like it or not, you're someone's role model. That's usually a kid.
Yeah, that's true.
If you have a 5-year-old, guess what? Your 5-year-old daughter or your 5-year-old son are going to look up into you. And if they hear that mom or dad, they had problems, but they fixed them much better than they had problems, they are still doing drugs. You don't want to normalize drugs in your environment because that's bad for your kids.
Right.
You don't want to kill another generation.
Mm-hmm.
And this is, another approach is, you're a father, you're a mother, look at your kids. You want the best for your kids.
Yeah,
so that's a non-judgmental way, but in the same time, you're using things from their life. Patients with drug addiction, they are human, and they have lots of emotions, actually. Some of them, they do drugs just because they are depressed or they are anxious. Some of them, they just self-medicate. That's the only thing they found to actually help him. And this is when we tell him, well, that's enough. I can help you. That's actually another way in approaching patients with such problem. Again, it's a big problem, a huge problem, and there's a very fine line between judgment and help. And we need to know how to be non-judgmental and how to be helpful.
One of the things that you see kind of commonly in pop culture is kind of this idea of like interventions and things along those lines. And you mentioned about how to be helpful without being judgmental. And I always felt like I've wondered if the best process would be the friend or the loved one that might be, where you're in a more private setting or at a quiet table over a cup of coffee or something, and you're talking about this kind of thing. And then you see, like TV shows or whatever it might be, where suddenly the whole family shows up and they're telling them, this is how you've hurt me and this is what we need to do. Maybe it's a case-by-case thing. I'm not so sure, but you need to be somewhat careful too when you're approaching someone, when you start what maybe feels like guilting them into trying to seek help of some kind.
Yeah, exactly. So you cannot do it when you're fighting them. You can do it when you have a good moment. Now the holidays are coming.
Oh man, that was going to be my next question.
Exactly. Christmas is a great time for good family talk. It's a great time to actually sit together and talk about our problems and talk about how to fix them. And I really wish Merry Christmas for the whole state, for Charleston, for everybody who hears us and everybody who doesn't hear us today. It's just that's the time of the year where we need to talk about our problems and how can we fix them.
Yeah, that's very true. By the way, if you're hearing a portion of this program and there's somebody that you wish would have heard it, we do have a podcast that will be up just a few moments after this program is over today. You can go to WCHSnetwork.com/podcast or just WCHS Network, and you can click the podcast link. That'll take you to this program. And you can refer that to anyone that you think that, hey, you might want to listen to this program, see what they have to say. They give the phone number to call several times. So that's a good way to maybe get someone introduced them to be thinking about it anyway before you talk to them anymore. Once again, the contact information, the location of COATS, of the Comprehensive Opioid Addiction Treatment Program, is 3200 McCorkle Avenue. That's over in Canal City, I believe, right? 3200 McCorkle Avenue in Canal City. The phone number is 304-388-1000. 304-388-1000 is the phone number. And then online, more information at WVUPC.org, WVUPC.org. And my guest this morning is Dr. Hani Nahza with the COATS program. So we've talked a little bit about trying to break the ice and getting your loved one enrolled into the program. Let's say that you kind of break down that barrier. You have someone who wants to self-check into COATS, who wants to be part of this program, who wants to get their life under control again. What's going to be the first things the first steps they need to take? Obviously, you can make the phone call. After you make that phone call and you make the initial contact, what should they expect?
Okay. So after they make the phone call, they will speak with our case manager. And the case manager will go over the code module and the requirements and stuff like that. And if we have like a verbal agreement on the phone, I usually see them for the intake. So the intake is not only tell me about what's going on with drug addiction. It's tell me what's going on, period. So it's going to be an open discussion. We meet, we talk. And by the end of that meeting, I either say, well, you're a good candidate for Suboxone treatment, or Suboxone is going to be a monster for you. You have to think about other options. But anyway, either way, they can be part of our program, and either way, we can actually treat them with our behavioral module. So it's not necessary that you want to be on Suboxone to be part of our program, because we have lots of other options that we can do or we can offer. And pretty much, we try to promote that it is a good doctor-physician relationship. I try to know my patients very well, and I want them to know me very well, so we can have this relationship where they are honest with me, and I am honest with them. That's honesty. That's actually number one, and that's something whenever we learn, we can actually fix problems. If we're not honest about our problems, that is a big problem by itself.
Yeah.
Yeah.
And I think that when you're talking about making the initial contact and wanting to enroll in the program, it's very important to be very honest all the way about exactly what you're suffering from, all the way through the interview and when they meet with you and everything. There's no point in hiding anything at that level. If you want to get help, you need to get help for everything that you're suffering from. So you want to be completely honest when you're doing that. It can be hard for a lot of people, especially because we talk about culture and the way that folks are kind of indoctrinated into this life sometimes. Sometimes lying is part of that. I mean, it just becomes second nature because you're covering things up so often, illegal activity, that it just becomes second nature to lie about the smallest things. You can't do that. You have to be honest with your provider to make sure that you can get the best personalized medicine. Because I can tell in talking to you, you're very passionate. You said you believe in personalized medicine, which means there's kind of a holistic approach that you have to take. It's not only the medicine, it's not only the counseling and the meetings and things like that. You take the personality and the person into account when you do that. They have to be honest with you when for you to be able to do your job properly.
Exactly, and the good thing now, we have lots of things that, like the urine drug screens we use are very comprehensive. And also, we do, of course, strip counting and pill counting and everything. We're required to do that in Board of Pharmacy, which I think the law was made to help patients and help providers actually provide better care. But honesty is a cornerstone. And I tell my patient, if you're honest with me, I'm not going to give up on you.
Right.
So that actually promotes honesty. We don't want to cover up problems, because guess what? We need to uncover problems and we need to fix them. So I found this very, very interesting when actually patients will just cooperate with you. They feel like you care, they cooperate with you. So again, we go back to the same point. My patient, they feel estranged from the whole world, especially the medical world, because some medical provider can be very judgmental and can actually have less care for patients with substance abuse
and they become a pariah because of
yeah?
that. Yeah, absolutely.
Oh yeah. And I'm totally, against that because this is not what medicine is made for. From Hippocrates' era till now, medicine is for everybody who suffers any medical problem. And certainly drug addiction is a medical problem, a big medical problem as well, and a big psychiatric problem as well. We have a manual in psychiatry called DSM. And in any illness, any psychiatric illness should be present in DSM to call it a psychiatric illness.
Right.
And certainly drug abuse or substance abuse problems are a big chapter in that book. So this is a psychiatric problem with lots of medical consequences. Infectious disease, heart disease. Also, not only that, self-care will go down significantly. So I see lots of patients with bad diabetes and pain. That's the other problem. That's another challenge. And I usually walk my patients through how to treat pain if you have opioid addiction with non-opioid medications. And of course, that's going to take a while, but we work with them. Now, I just want to mention something just here for public. If you are on chronic opioids, do not expect that the opioid will take away your pain 100%. All the data will show opioid will take away only 1/3 of your pain if it's chronic. So I understand when we have chronic pain, we just want to fix it.
Right.
But opioid is not the answer.
There's so much better ways to approach that.
Oh
right?
yeah. Oh yeah. It's a holistic approach. Exercise, physical therapy, meditation. There's lots of things that we can use. Now, unfortunately, we don't have lots of resources, but we have some.
Right.
And we can try to use them.
Just briefly, we have just a couple minutes left here, but I did want to kind of give kind of the end game to the folks that are listening out there. Once you progress through the steps, you're not just cut off necessarily cold turkey. Meetings last for a little while longer, support lasts for a little while longer, or a lifetime longer if needed. But you've seen success stories, right? You've seen people that's come through the program and who now have come back and reintegrated into society.
Oh yeah. Now, I'm really happy, and to me, that's a Christmas present, actually, a huge Christmas present. That, of course, when I said we do weekly groups, but when our patients are doing good, we go to bi-weekly groups. I can proudly say that 50% of my patients are in bi-weekly groups now.
Okay.
So that tells me that they are doing great. And I tell them, I'm doing my job, but guess what? You did the bigger job.
Right.
Because lots of people are not coming to this program because they don't feel like they can do it. You are here. You are trying real hard. You are going right and left to get treatment. This is amazing. So I'm really proud of all my patients. They all have... they are all doing great jobs. And I really... I just want to tell them all, Merry Christmas. You guys did great, and I just want you to just go in the society and be normal again and help the society to get better.
So there is light at the end of the tunnel. All you have to do is make the phone call first. That's Dr. Hani Nahza, and he is from the COATS program, the Comprehensive Opioid Addiction Treatment Program from WVU Physicians of Charleston. Information online at wvupc.org, wvupc.org. But you need to make that phone call first. 304-388-1000, 304-388-1000 is the phone number. The address is 3200 McCorkle Avenue, Southeast. That's in Canal City. There is help for you out there if you are suffering, if a loved one, a family member. You just have to make the contact. You have to make the phone call and give yourself that Christmas gift of maybe a brighter future.
Yes.
Dr. Nahza, thank you so much for your time this morning, sharing this important information.
Thank
you so much. You're listening to WCHS Charleston. This podcast will be up at WCHSnetwork.com/podcast in just a few moments. Have a great day, everyone. You're listening to 580 WCHS.
96.5 FM Charleston and 104.5 FM Cross Lanes, FM Cross Lanes, FM Cross Lanes, FM Cross Lanes, FM Cross